Hello guys, my name is Dr. Kia. I am a medical doctor with more than 10 years of experience in the medical field and also as a researcher in the nutrition and supplement field for about 14 years. And I like to share my knowledge and my experience with you guys regarding some diseases and conditions. And I try to show you some solutions through following a healthy diet and lifestyle. I try to explain the material with simple language to you guys. So if you like my videos, please click on the rings and subscribe so you could be able to watch my future videos easily. You can also share my videos with your friends or people with the same conditions or disease. So this part is the third part and final part of the diabetes video. Now we can talk about the fat. Fat quality is much more important than quantity. The American Heart Association recommends people should limit the amount of dietary saturated and trans fat intakes. Recommendation from the Academy of Nutrition and Diabetes for healthy individual is 20 to 35% of total calories should come from fat. A Mediterranean diet rich in monounsaturated and polyunsaturated fatty acid may improve glucose metabolism and lower the cardiovascular risk. So, what is the monounsaturated fatty acid? Monounsaturated fatty acid are simply fat molecules that have one unsaturated carbon bound in their backbone. Monounsaturated fatty acid or MUFA are typically found in vegetable oils such as olive, nuts, avocado and canola oil and remain liquid at low temperature. And what is polyunsaturated fatty acid? Polyunsaturated fatty acid or PUFA are fatty acids that contains more than one double bond in their backbone. Polyunsaturated fatty acids are usually liquid at room temperature and are found in vegetables such as oil, corn oil, sunflower oil and soybean oil. In general, polyunsaturated fatty acid has much more beneficial effect compared to monounsaturated or saturated fat. Replacement with polyunsaturated fatty acid is associated with improving glycemia, insulin resistance, and insulin secretion capacity. So, what is the omega-3 fatty acid? There are two types of omega-3 fatty acids in fish, including eucosa pentatonic acid or EPA and docousa hexanoic acid or DHA. The consumption of 2 servings equal to 8 ounces per week of fish high in EPA and DHA is associated with improving blood sugar and lowering atherosclerosis. So, preparing fish without frying or adding cream-based sauce is recommended. Fish with high amounts of omega-3 includes salmon, albacore, tuna, mackerel, sardines, herring, and lake trout. The form of omega-3 in plants is called alpha-linoleic acid or ALA. Nuts and seeds high in ALA includes walnut, flax seeds, chia seeds, and soybeans, which cause a reduced risk of both sudden death and death from coronary artery disease in healthy adults. So, what is the saturated fatty or fat? Saturated fats are usually solid or almost solid at room temperature. All animal fats such as those in meats, poultry and dairy products are saturated. Processed and fast foods contains high amount of saturated fats. Some vegetable oils also can be saturated, including palm kernel and coconut oils. The dietary guidelines for American recommended consuming less than 10% of calories from saturated fatty acid could reduce cardiovascular risk. In general, saturated fat are not recommended because they increase LDL cholesterol or bad cholesterol and also total cholesterol. And diet high in saturated fat are associated with a risk of cardiovascular disease. Several large studies have shown that diet rich in monounsaturated or polyunsaturated fatty acid and low in saturated fats are associated with a reduced risk of cardiovascular disease. Another question is, what is the trans fats? Trans fatty acid or TFA are also called hydrogenated fat, which are fats created when oils are partially hydrogenated. The process of hydrogenation changes the chemical structure of unsaturated fats by adding hydrogen atoms or saturating the fat. Hydrogenation converts liquid oils into stick margarine. Manufacturing uses hydrogenation to increase product stability and shelf life. And as a larger quantity can be produced at one time, having manufacturing lower the cost. Researcher studies show that hydrogenation of fatty acid can increase LDL cholesterol or bad cholesterol and lower HDL cholesterol or good cholesterol. With the mandatory trans fatty acids labeling in 2006, a big push has been made on foods manufacturing to remove it from processed and baked goods. So the other question is, what is the cholesterol? Cholesterol is a waxy fat-like substance that found in all cells in your body. Your body needs some cholesterol to make hormones. The body makes enough cholesterol for physiological functions, so it is not needed through foods. But it is very interesting that the most recent dietary guidelines for Americans suggest that available evidence does not support a recommendation to limit the cholesterol consumption for the general population. Another question is, what are the stanols and sterols? Individuals with diabetes and dyslipidemia may be able to reduce total LDL and cholesterol by eating 2 to 3 grams per day of plants, stanols or stenols, which are typically found in enriched foods. Plant sterols are naturally occurring cholesterol derivative from vegetable oils, nuts, corn, and beans. An important role of phytosterol is their ability to block the absorption of dietary and biliary cholesterol from the gastrointestinal tract. The cholesterol-lowering property of both sterol and stanols is considered equal in short-term studies. The amount of sterols and stanols found naturally in normal diet is not enough to have a therapeutic effect. For this reason, many manufacturers add them to various foods for their LDL cholesterol lowering effects. You can find added phytosterol in margarine spreads, juice, yogurt, cereal, and even granola bars. Products that contain plant sterols can help reduce LDL cholesterol by more than 10%. You can find sterol as a supplement in the market or on Amazon. So, here is some practical advice on fat intake. Try to eliminate trans fats from partially hydrogenated oils. Check food labels for trans fats. Limit fried fast foods. Limit intake of saturated fat by cutting back on processed and fast foods and red meat and full fat dairy products. Try to replacing red meat with beans, nuts, skinless poultry, and fish whenever possible, and switching from whole milk and other full-fat dairy foods to lower-fat versions. In place of butter or margarine, use liquid vegetable oils rich in polyunsaturated and monounsaturated fat in cooking and at the table. Eat one or more good source of omega-3 fats every day by using fatty fish, walnut, soybean oil, ground flax seeds, or flaxseed oil. So the other big category of nutrient is protein. In individuals with type 2 diabetes, ingested protein can increase insulin response without increasing plasma glucose concentration. For this reason, carbohydrate sources high in protein should not be used to treat or prevent low blood glucose or hypoglycemia in people with diabetes. Protein intake goals should be individualized based on current eating patterns. So some researchers has found successful management of type 2 diabetes with meal plans including a slightly higher level of protein, usually 20 to 30%, which may contribute to increased satiety. It is important to know that there are no convincing studies to suggest a difference between animal or plant protein source and diabetes outcome. So here are some practical tips for protein intake. Include a source of lean protein with each meal 8 to 12 ounces per day. So good source of lean protein animals such as skinless poultry, lower fat cuts of beef or pork, fish or egg, and reduced fatty dairy products such as cheese or yogurt. Plant protein sources such as tofu, tempeh, legumes. Nuts or seeds. 1 ounce per day is recommended. Protein should be a supplement in addition to vegetables, fruits, and whole grains in a meal, not the entire meal. So, other nutrients are micronutrients. Here are some target guidelines for micronutrients. People with diabetes should be careful of necessity for meeting vitamins and minerals, which needs from natural food source through the intake of a balanced diet. Specific populations such as older adults, pregnant or lactating women, strict vegetarian or vegans, and individuals on a very low calorie or very low carbohydrates diet may benefit from a multivitamin mineral supplement. Here is some evidence that those on metformin therapy are at higher risk of vitamin B12 deficiency and may need vitamin B12 supplement if tests indicate a deficiency. So what is the carbohydrate counting? Carbohydrate counting is a tool that can be taught to motivate diabetic people so they can easily estimate the amount of grams of carbohydrate in a particular foods. The average woman needs about 45 to 60 grams, while men may need 60 to 75 grams of carbohydrate at each meals. This number could vary depending on individuals based on calorie needs, pregnant, ill, and people on medication, and also on level of physical activity. Another term is a glycemic index. So what is the glycemic index? The use of glycemic index, which is a scale that ranks carbohydrate rich foods by how much they raise blood glucose levels, which has been developed to identify and classify over 600 foods and their blood glucose raising potential. It has been demonstrated that high fiber, low glycemic index foods can help delay the absorption of glucose into the bloodstream, so helping to control blood glucose level. As a rule, refined grain products and potatoes have a higher glycemic index, legumes and whole grains have a moderate glycemic index, and non-starchy fruits and vegetables have a low glycemic index. Some tips for low glycemic foods include increasing the consumption of whole grains, nuts, legumes, fruits and non-starchy vegetables. Decreasing the consumption of starchy, high glycemic index foods like potatoes, white rice and white bread. Decreasing the consumption of sugary foods like cookies, cake, candy and soft drinks. So at the end, okay guys, this part was the last part of videos about diabetes. I will discuss another part of diabetes in future, which means another aspect of the diabetes in future. If you have any question, as always, please ask question and ask me on this page. If you like my videos, click on the bell icon and subscribe so you could be able to watch my future videos easily. Thank you for watching and being careful about your health.